I'm Dr. Sriram Chandramurthy, Associate Professor, Gayatri Medical College. I was asked to speak on the undergraduate and postgraduate education in the medical field. Nowadays, the class attendance is decreasing a lot. All the students are not coming to the class. Half of them are coming, and they are being lured by the illustrated content which is present all over the net and also the net notes. People are not buying any published standard textbooks. They are only reading small notes which are being prepared and published. These are the things which are not giving them comprehensive information regarding any of the subject. Like we used to purchase textbooks and then read from them. Now the guides have come and then they are only pointing out in an objective manner. And nowadays the classes, the number of students are being admitted. The classes have gone up in number, the students have gone up in number, and then 200 students in one class. The backbenchers are always sleeping and not paying attention, even though mic system and the screen is provided. So this should be, I think the classes should be divided into two of 100 each, and then two teachers go simultaneously to teach. And then record system should be maintained every year. Everything should be recorded. And then the FRA system is good, but only one time they are logging in. I think it should be made mandatory that they have to log in once they are inside the class, and then for the same class you have to log in and out. That will be much better for getting a better student attendance for the classes. The second thing is, it should be taken into consideration whenever you are making them qualified to pass the examination. Now, what happens is FRS is being taken, but it is not being considered, and then they are being somehow managing to go and write the examination. That should be seriously discouraged. More marks must be given for the internal examination. He should have control over the student, means the marks should be more than the hands of internal. And since it becomes so easy to pass, and we are all constrained to pass the people, children, and the students, so that we are allowing them to learn later, which is not happening. It's more dangerous to the society at large. Examination should be problem-oriented. It should be changed. The examination pattern should be changed. Problem-oriented, that means case type of discussion should be there. A case question must be given, and then depending upon that, there must be MCQs based on the case. And then such kind like ASCII, it should be completely modified with pictures and then case studies and such kind of things. Then the person will be able to test better the actual learning capacity of the individual. Skills should be learned. That should be tested in the oral examinations, and then the clinical examinations and oral examinations are a must, even though they pass the theory. The short answer questions should be encouraged than long answer questions. I think one long answer and rest of things must be short answer, like we are being done now. That's good. Mentor system is very good. But thing is, it is not being followed properly. Students are not coming to the mentor. Mentor should keep on searching for the students. The mentor must have some marks so that students will listen to the mentor. 4-semester system is the best, because every quarter the mentor will be able to assess the performance of the student, and then will be able to guide them properly. And the mentor should be given marks. Mentor should also be given some marks to be awarded to the student. And as far as postgraduate is concerned, they are taking 6 months peripheral posting. Whatever peripheral posting they are going, the amount of time which they are spending in the department or what they are getting from the department is really meager as far as my observation goes. And then that particular thing can be rectified by scraping the 6 months peripheral posting, and instead of that, organize one class from the specialties every week. Every week one specialty will be addressing, or these postgraduates will join that particular specialty in their case discussions once in a week. That's enough. And examinations must be like ASCII type MCQs, they must be time bound. Examination, when once the question comes, and then the candidate is expected to answer it in 1 minute, like what we are conducting quizzes in all the conferences, etc. So such kind of time-bound quiz, it was conducted in all the subjects, 3 papers or 4 papers, morning and evening for the same subject, in different manners, will be comprehensively covering, and the students will be effectively reading to answer it. And that can be, evaluation will be uniform, and then there will not be any bias, like handwriting, and then proper representation of the subject. When the student knows some subject, his English is poor, his handwriting is poor, such kind of biases will be totally taken care of. So, one examination, pre-final examination will be conducted 1 month prior to the main examination. Then, after 1 month, the final examination can be conducted, which can be of theory, and then later it will be practicals, and practicals usually must be from taken the care of skill development process, and then we can probably think of changing the postgraduates, especially specialties like ophthalmology, ENT, and rheumatology, gynecology. All these things can be probably changed. It can be made into 4 years. So comprehensive, it can be 2 years of comprehensive of the same subject, and then 2 years for the specialty subjects like retina, uvea, cataract and refractive surgery, and such kind of things in ophthalmology, like neurology, and then gastroenterology, such kind of things were taken for 2 years, so that you can get a comprehensive degrees of MS. No need of fellowship, going to fellowship. Some people are going to fellowship, some people are unable to go to fellowships. All these things will be reduced a lot, and then we'll get more number of specialists than general doctors. General doctors we usually can always be there, but if it is like this, if you want to become a general doctor, you can as well have a 2-year post-graduation, comprehensive ophthalmology, comprehensive ENT, or comprehensive anything. But 4 years, 2 years of comprehensive subject and 2 years of specialization with the same 4 years period will be much appreciated if it is implemented well. So allot seats according to their merit and also the performance in the practicals as well as their skills, and that deals more comprehensive and competitive students than anything else. You must also enhance such kinds of seats where people will be able to qualify well, and make rural posting mandatory for at least 2 years. 3 years is, I think, better to get a proper understanding, and they should be taken into serious note. If such kind of things happen, like we increase the period of MD for MBBS from MD, you take out the MBBS part, name as MBBS and make it MD like in US, so that the person will be qualified in the particular subject, and we have subject qualified people even working in the periphery, and they can practice seriously. So all these students, this happen only because if we can provide basic and advanced things both in the theatres, like good theatres and good training instruments, and with microscopes, with observer pieces, and then all the operative surgeries with monitors, etc. They provided that likewise to all the teaching people, it will be very good. All the people who are operating, the student people who are operating or on simulators must be video recorded, so that we can rather point out or guide them where they are going wrong. So such kind of simulator type of training should be given before they touch the actual human beings. So the journals, nowadays everybody is going in a way that they are not reading any books anymore. Students are not purchasing textbooks. They are only depending upon the internet. So I think the journals, if they are accessible through internet, through clinical key, it will be helpful for all the postgraduates or any graduates so far if it's implemented properly. And then that particular key, the password should be given to everyone, the teacher as well as the student. Then the CME should be conducted regularly, and then the persons are asked to contribute CME. And for external examinations, you can as well come from the same state, but from separate university or a separate medical college. Sometimes there are a number of DNB centers spread all over the city as well as in various cities. We can call them also as examiners for the examination. And this will save us a lot of time and money, and people will definitely come to examine our students. Practical marks and record should be given enough emphasis. They should be simplified a bit more than actually taking a lead, how a patient should be examined, etc. That should be given slightly, I think it should be a little simplified than what is present now. It's good, it's really good now, but the thing is the concentration is going only for that and not knowing in holistic fashion. So I request that the authorities to consider these points in amending the syllabus. Thank you.